Nausea is a subjective complaint defined as the sensation of vomiting or the urge to vomit. It may precede vomiting but may sometimes stand alone. Vomiting, also called emesis, is the ejection of stomach contents through the mouth. Both nausea and vomiting are not considered illnesses but may be signs and symptoms of underlying conditions or may be secondary to triggers. Cancer with ongoing chemotherapy. Nursing diagnosis: nausea and vomiting related to chemotherapy status secondary to cancer as evidenced by reports of nausea, vomiting, and gagging sensation. Desired outcome: the patient will manage chronic nausea, as evidenced by maintained or regained weight. Intervention: assess the extent of nausea, vomiting, and limited food and fluid intake. Rationale: to provide baseline data and determine the need for hydration and nutritional support. Intervention: encourage to try dry foods, crackers, toast, when nausea occurs. Rationale: to decrease discomfort and enhance intake. Intervention: encourage ice chips, sips of cold water, and ginger products when nauseous. Rationale: to promote hydration and decrease the discomfort associated with nausea. Intervention: promote a bland diet and decrease intake of greasy and spicy food and caffeinated beverages. Avoid milk/dairy products, overly sweet, fried, and fatty foods. Rationale: to reduce gastric acidity, improve nutrient intake, and prevent further nausea and vomiting. Intervention: administer antiemetics regularly before, during, and after administration of antineoplastic agents. Rationale: to prevent and control side effects of the antineoplastic medications, including but not limited to nausea and vomiting. Intervention: monitor weight regularly. Rationale: to monitor nutritional status throughout the chemotherapy and address malnutrition and dehydration if present. Intervention: discuss possible complications with the healthcare team. Rationale: timely recognition of possible complications leads to timely solutions. Intervention: educate patient to avoid foods and smells that trigger nausea. Rationale: to decrease the occurrence of nausea and vomiting. Intervention: advise the patient on non-pharmacologic ways to reduce nausea, such as guided imagery, deep breathing exercises, and relaxation. Rationale: to control and manage nausea, and to promote independence. Intervention: inform the patient and the caregiver to seek professional assistance if vomiting persists for more than 24 hours. Rationale: persistent vomiting has serious consequences. Timely assessment may prevent complications brought about by this condition, i.e., dehydration, electrolyte imbalance, and nutritional deficiencies. Quick facts that nursing students need to know about nausea and vomiting. Medical history: knowing the patient's medical history is crucial in assessing the cause of nausea and vomiting. It is important to know if the patient has a history of gastrointestinal disorders such as acid reflux, ulcers, or inflammatory bowel disease. Medications: some medications can cause nausea and vomiting as a side effect. As a nursing student, it is important to know what medications the patient is taking, the dosage, and when they were last taken. Allergies: allergies to medications can cause nausea and vomiting. As a nursing student, you need to know if the patient has any allergies to medications. Dehydration: nausea and vomiting can cause dehydration, which can lead to serious complications. As a nursing student, it is important to monitor the patient's fluid intake and output. Vital signs: nausea and vomiting can affect a patient's vital signs such as blood pressure, heart rate, and oxygen saturation. As a nursing student, it is important to monitor these vital signs to assess the severity of the patient's condition. Nutrition: nausea and vomiting can cause a patient to have poor nutrition, which can lead to further complications. As a nursing student, it is important to assess the patient's nutritional status and provide appropriate interventions to maintain adequate nutrition. Visit us at nursestudy.net for over 1,000 free nursing diagnosis and care plans.